A quick refresher. ODMAP is a real-time overdose surveillance system that supports public safety and public health efforts to mobilize immediate response to overdose spikes. So this all depends on how fast you enter the data, and that's how fast real time is going to be. So for us, we enter it, they try to enter it at the end of the day or the beginning of the next day. So we're not like exactly real time, but we're pretty close. And some people, they enter it as soon as they get on scene. So they're right at real time. So this allows first responders, law enforcement, fire, EMS to track known and suspected overdoses as they occur using a mobile application, or you can use the computer as well. Shows overdose activity across multiple jurisdictions, ability to upload data and view the map in real time. And this is all provided free of charge to first responders, government agencies. General public does not have access to this. Provide certain stakeholders such as public health agencies access to ODMAP national map to view and analyze data. Okay. And here's some best practices. So I got a short video for y'all, then we'll go into some more information.
So now we're going to transition a little bit to now that this has either been an introduction or a refresh or recap on ODMAP, to transition to some best practices and case studies. So we've been working with Erie, New York for almost 3 years now. So it's been really interesting and informative to watch their strategy evolve and change, and really to also see the impact. For them, the Cheektowaga Police Department is within Erie County, and they are responding to a large number of the overdoses, either with EMS or perhaps they get there first, so they're carrying naloxone. So when an officer responds to a suspected overdose, they leave this packet right here. And inside of it has information on treatment and prevention, and they're also letting them know that a peer recovery coach will be contacting them. So you're probably wondering, well, how are they able to get that information about the individual since it's not an ODMAP? So they've developed a really innovative strategy. They do talk about it on a video that we host on our website. So this is Assistant Chief Brian Gould and then Cheryl Moore, who works at the Erie County Health Department. So there's a link on our website or YouTube if you want to take a look at it for more information. But basically, Cheryl and the folks at the Erie County Health Department, they use those filters in ODMAP on the national map. And so they filter down by New York and Erie in the last 24 hours. And when they see that a new overdose has occurred, they have a standing memorandum of understanding with the police department. And so they just email the records department and ask for a copy of the police report for the suspected overdose that occurred yesterday in the area of Main and 2nd. And so then they get the police report, and then the peer recovery coach contacts them by phone. And over the past couple of years, their overdoses have declined significantly. They're still evaluating how COVID has affected that, as they are seeing an increase. But prior to the COVID-19 pandemic, they were seeing a drastic decrease in both fatal and non-fatal overdoses. So this is another statewide example. So this is from Connecticut. All of this is it's publicly available. So if you want to look more at this, or you want to learn more about Connecticut in general, you can just type in the Connecticut EMS SWORD, and SWORD stands for the Statewide Opioid Reporting Directive. So every month they put out a newsletter. And so this data that you see is from ODMAP on the right-hand side there. And basically they have a strategy that when a first responder and even a bystander in the state of Connecticut administers naloxone or responds to an overdose, they call it into the Connecticut Poison Control Center. So you can see here that they're able to put that data back out to the public to help inform them. So this is a really recent press release from Shelby County, Tennessee, which is in the Memphis, Tennessee area. We've worked really closely with Shelby, over the past year or two. And there's more from Shelby actually on our website where there's a video from David and Courtney at the Shelby County Health Department talking about their strategy. But basically, Shelby County uses a ODMAP generated spike alert. And so in ODMAP, there's a feature that's called a spike alert. And basically what it does is it takes a look at data for a rolling 24-hour time period for a state and county. It looks at data for the past 90 days or however much data is there if it's less than 90 days and applies 2 standard deviations above the mean to determine a spike. You can also set your own threshold. But basically what will happen is the spike alert, you set up a bunch of email addresses that you want it to go out to. So a lot of times we see like a multidisciplinary email chain, from fire and EMS, police, DAs, hospitals, whoever. And it will say, hey, Shelby County's Tennessee is in a spike. There have been, 10 overdoses in the past 24 hours. Your threshold is at 9. And basically it will keep alerting you as overdoses continue to increase if they do. So it'd say, Shelby County, Tennessee is still in a spike. And then ultimately, once you get back to that threshold of 9, less than what you determined, it will say the spike alert in Shelby County, Tennessee has ended. So they've been putting out some press releases here, which if you just go to, Shelby County, Tennessee Health Department, it will take you there and you can see some of them. But spike alerts are definitely a method where we have seen stakeholders set up a framework of different levels of thresholds and what they mean. So, the first level could be convening of a multidisciplinary team. The second one could be going out and targeting, harm reduction into those areas. And the third one could be informing the public. It just depends on what makes the most sense. But another way that a spike alert can be utilized is to trigger a overdose response team or quick response team. So here's an example here from Oneida County, which is in New York. And so this is information that they put out after they identified a spike using ODMAP.
Okay, and we'll go on to the next slide here. So that was just some of the examples. So I'll go dig a little bit deeper into the examples of some of the best practices that others are using. So Oneida, so she touched briefly on this county in New York. So what they do is they send spike alerts with important information to local news. And they also started a text messaging system for all county residents that they can sign up to, and they can receive spike alerts. So as soon as a spike alert happens, you'll get a text message saying there's a recent spike in your community. And they also established a 24/7 peer referral process to dispatch certified peer recovery advocates to overdose victims identified in ODMAP and help link them to treatment and recovery services. And they also started a public dashboard that displays overdose data for the county. So I'll show you that real quick. So this is their dashboard. So we're actually going to try to make something similar to this here at EBCI, but we're still working on it. But as you can see, all of the information, it pulls in from ODMAP. So you have the different community areas in Oneida County. They'll have the middle one is Rome. So there's 34 or 38 total in that area in the past. I think this is based on the past week. Yeah, it goes by the weekly ending date. So this was updated 7/15 for this one. And so it just kind of goes by that for the map view. And then they also go by the yearly overdose percent by age group, weekly overdoses by suspected primary drug type. I'm guessing this must be a yearly based on, we've only had 2 in the past week. But they also have, or had 4 overdoses the past week. And they also go through and do juvenile overdoses and repeat overdoses and stuff. So it's really good information. This is available to anyone. They have a public dashboard here. So Rochester, Minnesota. So they're another one that utilizes ODMAP. So what they do is they send spike alerts to local news and warns community about potential issues with the drug supply, basically. So like this one talks about the potential of fentanyl-laced drugs. In Erie County, New York. So when a police agency responds to a suspected overdose in Erie County, it gets entered into ODMAP. Then the ODMAP is monitored daily for new overdose submissions. And when a new overdose is identified, it contacts the police department for a police report containing the overdose survivor's information. Once received, a peer recovery coach contacts the survivor within 24 hours to discuss treatment modalities. So they're kind of using it to help the overdoses get treatment there. So that's good. Here's St. Paul, Minnesota Police Department. So they established a community outreach stabilization unit, which is a mental health unit within the St. Paul Police Department. And within that COAST unit, they also have a recovery access program, which includes partnerships between the St. Paul Police Department and a licensed clinical social worker to conduct post-overdose outreach. So they utilize ODMAP to track overdose data, share drug trends, and notify stakeholders and community of spikes in post-overdose outreach. And see on the side, that's just some of the stuff that they do in a little bit more detail there. So St. Paul Police Department also reminding people that Minnesota's Good Samaritan law, which protects people from being charged or prosecuted if they act in good faith while seeking medical attention for another person experiencing a drug overdose. Officers will be visiting areas of the city where heroin use is common, informing people about overdose risk and offering information about chemical dependency resources. So they also use it to just see the different hotspots in the area to try to go out and advocate for recovery and stuff in those areas. And here is Wilmington, North Carolina Police Department. So they use geospatial awareness, patrols areas where overdoses are occurring. So that's similar to the previous one. So they try to go out to the various hotspots in the area to try to give resources and help those people there. That targets community outreach based on these areas in need. So this LED program, which is a pre-arrest diversion approach, uses ODMAP to determine where outreach needs to occur, and a quick response team visits and assesses each person who has overdose. So they also assess every person who overdoses as well. So, and then that's all that I have there. And if y'all have any questions, feel free to ask.
Hi, Mark. This is Eric over here in Portland, and excellent presentation, and super excited about that ArcGIS mapping in Oneida County. And I was curious about the sort of staffing to coordinate both the ODMAP utilization and the referral over to peers. Was that sort of like one person, or was that wrapped into someone's already established position, like, you know, change in job or not job title, but position description, where they would kind of add on these responsibilities? Or what sorts of approaches have you seen?
Yeah, it sounds like it's a added position. So they added the full different like peer recovery specialist. So somebody that's just job title is specific for that. So different places have different ways that they do it, but from what it looks like, most of them are using that approach.
But to get the information and that coordination to the peer, do you think it was someone who was already an ODMAP user or?
Yes.
Okay.
Yeah. So somebody that's already ODMAP user, some of them, they mention police department reports that data to that person, and other ones, the health department reports that data to them. So I think it's whoever has access to that data that they can share it to that person. And it's as simple as just going in and then exporting the data and sharing it, basically. Real simple.
Thanks, Mark.
Mm-hmm.
Do we have any other questions for Mark? You can unmute yourself or type in the chat box. We can read your question aloud. Thank you for a wonderful presentation, by the way.
Mm-hmm. Yeah, and some of this stuff, it's like we didn't even know like all this like different approaches that we could use. So we're gonna like look into a lot of these, especially the ODMAP dashboard, trying to do a public dashboard like that. So we're actively trying to create one of those as well.
That's very cool. I wonder if ArcGIS or Tableau might be an option. I'm not sure what sort of data visualization you've used.
Yeah, they use ArcGIS to build that one that I showed. So yeah, I've been in contact with Esri ArcGIS to help to build something out that's similar to that for here.
And do you already access TechSoup for software like ArcGIS?
TechSoup, I'm not familiar with that.
Oh, I'll put it in the chat. It's
Okay.
As a tribal organization or a nonprofit, you're eligible to get software at a significantly reduced rate.
Okay, nice.
Any other comments or questions from Mark? If not, there is the survey link in the chat box. We'll fill that out for us. That'd be great. Give some feedback. And this is the last session of ODMAP. So thank you all for joining us for this series. There are recordings. If you do want the recordings, just send me an email and I can send that to you with the recordings on there. And I don't have anything else. So thank you all so much for joining us for this session. Thank you all.
Thank you. Bye.